Yes, I think data is very, very important in terms of wound care and good quality data and very effective data. But I think the story evolves around value. What value can we bring in terms of data? And I think the equation that I usually use is value equals outcomes divided by cost. And what do I mean by outcomes? I mean productivity, I mean efficiency, clinical, I mean financial. So what happens if we remove outcomes from that equation? You have value equals cost. Now that's not good for patients, and that's not good for the health service, and that's not good for industry. So how do we get these outcomes? Obviously it's through data. And that's why data is very, very important. And you'll hear a lot about real world data out there and real world evidence. And there is a difference between sort of your randomized controlled clinical trials, which deals with efficacy and takes a long time to do. And then you got the real world evidence, which is how effective products and innovation is out there, which is really, really quicker to do. And usually you do that through auditing and developing real world data to generate real world evidence. I think it's not that we want to go too far into the real world evidence side of things. So trying to get a balance between randomized controlled trials and real world evidence and getting that balance. And one way we do that is through clinical audit. And I think as an industry, I think health service shouldn't be afraid to partner with industry in terms of generating real world evidence and collecting real world data. We have the tools to do that. We have the resources to do that. We have health economists that work in industry. We have people like healthcare outcomes and clinical people that can support different health services. Because at the end of the day, if you're using a product or you're using an innovation or even using a service, if you can't measure the impact of that, you do not know what is happening, the outcomes that you're generating. And that's where industry can really, really help in terms of that. The other things around data is there's a lot of different systems out there at the moment. And I think if we look at the NHS, I heard a quote once about 246 different systems out there for collecting data. See, but none of these systems are talking to each other. So the data is very isolated. So you can imagine if all these systems started talking to each other, the volume of data that you would have, the change management that you could do. But I think in terms of wound care, that could lead to predictability. So you could look at comorbidities, you could look at risk factors, you could look at chronic conditions, and you could really understand how long it would take that wound to heal. So that's one thing where you can use, but that means systems having to talk to each other. The other thing that I think is lacking maybe would be, an industry could partner on this, is a wound care registry. We have registry in orthopedics and various different registry, cancer registries, but we've got no wound care registry. And that's something I think that will be important in moving forward. And NICE have recognised that the importance of real world data is and real world evidence to bring out a framework to make sure that there's a proper methodology in industry and health services are sort of conforming to this methodology. And I think I'll finish up by saying we are there to support. We're there and willing to work. We're very transparent. The NHS will own all the data that if industry works with them. But if we don't have data, all we have is an opinion. So that's why data is important.